6:14 to your health now. PCOS affects 8 to 13% of reproductive aged women.
Yeah, the common hormonal disorder may have an impact on their future cognitive and cardiovascular health. Health reporter Haley Hernandez is here to explain.
Good morning, guys. So the condition is common and women tend to seek treatment for the unpleasant side effects. But the data on long-term health in these women is something that needs to be prioritized earlier in life. PCOS, or polycystic ovary syndrome, affects 116 million women worldwide and is characterized by hormonal imbalances, irregular periods, and cysts on the ovaries. Dr. Stephanie Coulter, director of the Women's Center at the Texas Heart Institute, says the condition leads to symptoms like infertility and weight gain that aren't simply from overeating, but a genetic condition that can set you up for a lifetime of complications.
Their ovaries are driven by their body chemistry and their genetic code to make male hormones. So there's a lot of interplay between that and insulin resistance, obesity.
Dr. Coulter says that increases your risk for cardiovascular disease. And a recent study published by the American Academy of Neurology found that women with PCOS may also have an increased risk of cognitive impairment. Researchers followed over 900 women over 30 years and found those with PCOS performed worse on tests measuring memory.
That leads to Alzheimer's and dementia can help us identify therapies that would work best for women.
The exact mechanisms underlying the link between PCOS and health complications are still being explored. However, hormonal imbalances, insulin resistance, inflammation, and metabolic dysfunction associated with PCOS are thought to play a role. Doctors say women with PCOS should protect their health by exercising, controlling their blood pressure, and keeping their cholesterol levels in a healthy range.
And lifestyle changes that can help us to become more resilient.
And Dr. Coulter said it's important to get specialized care by regularly seeing an endocrinologist.
You need to be very clear about assessing risk in certain individuals at an earlier time point. And this is where it's going to take the entire medical community to help us.
So she says that by the time you would see a cardiologist complaining of symptoms, then it could be too late. So diagnosing PCOS young and seeing a specialist to assess and mitigate your risk is really the best method of treatment.
Okay, so Haley, we talked about the side effects of PCOS. Can you actually treat PCOS?
Yeah, I actually spoke to OBGYN Keith Riggs on the show yesterday, and he said that they mostly treat the symptoms. Like you can give medication to treat excess hair, infertility, acne, but to actually improve the condition, PCOS, he said patients see the best results when they lose about 5% of their body weight.
Okay.
So losing weight is what they would recommend.
Gotta get it checked early if you're having any symptoms. All right, Haley, thank you.
Thanks, guys.